In this video, we will review the bones and joints involved in common joint movements. The knee contains synovial hinge joints composed of the femur, tibia, and patella. During knee flexion, the tibiofemoral joint allows the knee to bend, while the patellofemoral joint acts as a pulley, with the patella sliding inferiorly and posteriorly into the femoral trochlear groove. The joint angle decreases during flexion. During knee extension, the tibiofemoral joint acts as a hinge, with the tibia gliding interiorly and rotating externally. Simultaneously, the patellofemoral joint acts as a pulley, with the patella gliding superiorly within the femoral groove as the quadriceps muscle contracts to tighten the patellar tendon. The joint angle increases during extension. The shoulder contains a ball and socket glenohumeral joint and a functional, false joint, the scapulothoracic joint. These are composed of the humerus, scapula, and clavicle. During shoulder abduction, the humerus and scapula move with 120 degrees from the glenohumeral joint and 60 degrees from the scapulothoracic joint in a 2:1 ratio, totaling 180 degrees of elevation. The joint angle increases during abduction. During shoulder adduction, the glenohumeral joint moves the arm toward the midline while the scapulothoracic joint undergoes downward rotation, depression, and slight retraction to stabilize the scapula against the thorax. The joint angle decreases during adduction. The wrist contains a synovial pivot joint composed of the radius and ulna. During wrist pronation, the distal radial ulnar joint acts as a pivot joint where the radius rotates anteriorly and crosses over the stationary ulna. This motion involves the radius sliding over the head of the ulna, with the distal ulna relatively moving to the dorsal side. The joint angle decreases during pronation. During supination of the wrist, the distal radial ulnar joint is in a position where the radius rotates laterally around the head of the ulna. The joint angle increases during supination. The ankle is a synovial hinge joint composed of the tibia, fibula, and talus. During ankle dorsiflexion, the wider anterior part of the talus rolls forward and slides posteriorly into the ankle mortise, increasing stability and tightening the surrounding ligaments. The joint angle decreases during dorsiflexion. During ankle plantar flexion, the narrower posterior portion of the talus moves into the mortise, making the dolateral joint less stable. The joint angle increases during plantar flexion. The hip is a synovial ball and socket joint composed of the femur and acetabulum of the pelvis. During hip rotation at the coxofemoral joint, the femoral head spins within the acetabulum. Internal rotation turns the thigh inward, while external rotation turns it outward, generally allowing for a 45-degree range of motion in either direction. The joint angle decreases during internal rotation and increases during external rotation.